Okay, well, good morning, everybody, and welcome to our Oversight and Engagement Board. This is the first of these boards for a little while now, and it's the first since the new election. So we've got a couple of new members. I'll be chairing it. I'm Councillor Matt Golby. I'm the Cabinet Member for Public Health and Adult Social Care in the West Northamptonshire Council, and my colleague, Councillor Helen Harrison, is going to be the Vice Chair, who's my equivalent in the North. So welcome, everybody. So let's have a look at the agenda. Welcome and apologies. So Cheryl, do we have any apologies? I think you're on mute, Cheryl.
Sorry, it's Councillor Smithers and Toby Sanders.
Okay. And minutes of the previous meeting from the 29th of April public session. So that has been sent round. Are we happy to agree that, colleagues? Yeah, thank you. And the action log, that has been circulated as well. Cheryl, did you just want to run through that briefly, because it was quite some time ago now? And you're on mute, Cheryl.
There was an action for the revised local outbreak plan to be circulated to the board, and I've got the link for that, so I'll circulate that this morning. Then there was a completed action for a list of dental practices that were accepting NHS patients to be circulated to the board, and that was circulated on the 29th of April. And Health Watch would review the number of complaints from local residents who are struggling to get access to their GP surgeries, and that was completed, and the complaints have been reviewed and shared with the CCG. Whether Professor Pope would like to add any more to that?
Not an awful lot to add, because as I said earlier, I am on holiday. I saw the apologies for the seagull noise. I saw the update note that Kate Holt sent through, and nobody has flagged a specific issue to me, but what we can do is come back to you if there are any outcomes arising, but none have been flagged to me anyway prior to today.
Okay, is there anything to add to any of that, Cheryl, or any comments from colleagues?
They were the only actions from the 29th of April. Yeah. So, yeah.
Okay, thank you, Cheryl. So the refreshed terms of reference. So these have been circulated. I know myself and Helen have had the opportunity to comment or add anything. I'm happy with them. Is there any comments from any other colleagues? Are we happy to accept the ones that have been circulated? Lucy?
I think the only thing it's worth adding is, obviously, with the imminent announcement from Boris Johnson on Monday about whether we'll proceed through the final stage of the restrictions being removed. Obviously, the local Oversight and Engagement Board was part of the contain function that was obviously local authorities were required to execute. So we will obviously be expecting at some point guidance about how this board will continue and whether its remit may change in light of us moving to sort of COVID management as business as usual. But I'll keep you updated if I do get any information in that regard. Yeah,
thank you, Lucy. Helen?
Thanks, Matt. Just following on from what Lucy has said, I wonder what will happen, because there's been some noise today, suggestions that there's going to be some more guidance coming out for clinically vulnerable people, and whether that'll affect this board and what we do, I guess remains to be seen. But that's obviously something that Lucy will be keeping an eagle eye on and will be able to update us on.
Excellent. And Danny?
Thanks, Matt. And it was just to say that in the refresh of the document and the prune of the names of people that are no longer with us, my name dropped off there, but we've already been in touch with Cheryl and she's added it back on for the version that's adopted today. Yeah,
well done. Thank you, Danny. Excellent. Good. So with those minor comments and points, we're happy to accept the terms of reference, notwithstanding the fact that things may change, quite imminently. Okay, thank you. So we'll move on now to the first substantive item, which is the Northampton Police update, and we've got Simon on the call. So welcome, Simon, and the floor is yours. Thank you.
Thank you, Councillor. Thank you, everybody. I'll give you a brief summary of where we are policing point of view. As we've seen over the last month, from a policing perspective, our demand is back to normal, and our COVID work really is quite minimal now, with our normal demand, be it road policing, criminal damage, when it is just without those usual levels of calls coming into our control room now. What we have seen, we're getting a reduction in the calls we are getting from the public regarding breaches. The most common ones are still the groups. We are personally getting an increase in border force referrals because of the foreign travel issue, which we're dealing with, but those are slightly slowing up. If you're interested in the we've got the Grand Prix coming up. I know I mentioned it, Lucy, briefly earlier. That's coming up next weekend. You'll be aware that that is now looking at a full access. It's been treated as I think they call it a test event under the event research. So we're looking at full attendance, which could be up to 300,000 over the 3 or 4 days period, which will be an interesting challenge. So it'll basically be the largest event, I think, since the pandemic for the UK to manage. And we've done various tabletop exercises, etc., to manage the event as we normally do. Biggest challenge, I think, will be the testing regime and the checking to get people into the event. But all of that's being managed. And to the favourite topic of FPNs issued by the police, just to show you the difference between the 17th of May and the 5th of July, we've issued only 23 fixed penalty notices in that period. If you look at the similar period of 17th of January to 5th of March, we issued 1,319 over a similar 3-month period. That's the level of sort of enforcement and the complaints, because most of those generally are when public have complained, that we're now getting. Actually, but our normal work has picked up. So we've had quite a lot of mutual aid commitments down to the G7 down in Cornwall. The Euros have actually added additional pressure on us as well. Although to date, I have to say, we haven't had any major issues within the county as a result of the Euros competition. We've had the additional policing resources on, but we have not seen any major outbreaks of disorder or similar that we have experienced in previous events, which is good news. And again, comparison of the reports that we get recording breaches from the public. Again, from 17th of May to the 5th of July, 202 calls from the public. 17th of January, 5th of March, 2,822 calls from the public. So you can see, if the public's concerned, we really have seen the drop of calls coming into the police force. For us personally, as the force, our resilience is okay. We've just followed the government guidance and advice from Lucy, i.e. we're asking all officers and staff to do a lateral flow test before they turn up for a shift of duties. That's going through. We're waiting for the government guidance that will come out. Our intention probably is to still ensure around our workplaces things like face masks, officers wearing face masks double crewed, as I have real concerns that it's not so much the illness, it's the self-isolation, and we need to ensure that minimum staffing is available to still deliver the police service across the county. But we'll work that through with advice and seeing what the government says on advice. And then the joint enforcement team is still there, and that'll still probably continue post-pandemic, as we have had some excellent partnership working, I think, throughout the pandemic, and those relationships that have built up can be used to tackling some of the other broader crime issues. And that's really my summary. Thank you, Councillor.
Thank you, Simon. Are there any questions from colleagues? Any points to pick up? I'll just ask a question. It may be a question for Lucy, really. Silverstone is a huge event, as Simon mentioned there. I take it as a system, we've had a reasonable input into, obviously the safety for a start and all the testing arrangements.
Reasonable, I think, is a significant understatement. So yes, obviously we've been working really on and off with them since last year when we supported the Behind Closed Doors event. So we're obviously very familiar with the site, we're very familiar with the staffing movements. Obviously the challenge this year, at quite short notice, we've now been notified that, as Simon says, there'll be up to 130,000 people on site at any one time. So both myself and Anna Pernasen, who's one of the doctors in my team that's been supporting last year as well with some of the big events, We've done site visits, we're dialing into sort of international calls and conferences, working with Department for Health and Social Care, DCMS, so the Department for Media, Sports and Culture, and obviously Public Health England, both at a regional and national level, to obviously make sure that there's actually 2 pilots that are going on. One is around international travel, because a lot of obviously the teams will be travelling internationally to arrive in Silverstone to compete, but also then you've got the actual attendees pilot from a point of view of them using either double vaccination at least 14 days prior to the event as access, or indeed a lateral flow test within the last 48 hours that returns negative result. For every day that they attend, they have to demonstrate those things. Obviously within the pay line, so within the circuit itself, as Simon also knows, really it's Department of Health and Social Care and DCMS who are managing that pilot. So they take on a lot of responsibility around the policy and protocols. We're just making sure that there is on-site testing available, both lateral flow and PCR for anybody who turns positive, and the ability to genomically sequence that as soon as possible, so we understand if any outbreaks do occur, what variant we're dealing with. But obviously we have a huge amount of responsibility to all of the local residents in the surrounding area, and to ensure that all of the campsites, hotels, etc., that support the thousands of fans that come and stay within the local vicinity as well. So our environmental health officer teams, again, have very long-standing relationships. Cass doing a great job linking in comms, both within the circuit and then outside in some of the campsites and hotels. So there's a huge amount of activity that's been going on for a number of months, but obviously that's stepped up significantly since we've known that it's going to be a pilot event.
Excellent, thank you, Lucy. Is there any further comments or questions for Simon? Okay, thank you, Simon. Well, I've followed your reports over the last year or so, and you know, the police have done a fantastic job in enforcement for a start, and dealing with you know, the wider pressures of the pandemic. So as of all the authorities we know, but thank you very much, Simon.
Thank you for the comment.
Thank you. We'll move on to the weekly surveillance report, and that is Lucy. Do you have some slides to show us? Thank you.
Yeah, so Cheryl will bring those up. So this is obviously our weekly surveillance report that we publish every Friday. We obviously used to have the weekly press conferences, as obviously the demand has sort of dropped off with regard to the need to communicate quite as frequently. Generally, we still produce the reports, but obviously haven't always had those press conferences. So I'm quite happy just to quickly go through the key headlines from last week's report. So do note, obviously the data is always delayed. So this is confirmed data, but it is just over a week old. So it's from up to the 27th of June. And in that week, 474 residents had tested positive, which was quite a significant increase on the previous week. Household transmission still remains the greatest cause of onward passing of the virus. And actually, interestingly, for the first time since we've obviously been able to track in age groups, the 20 to 29-year-olds had the largest number of crude cases. Now, it also happens to be males as well. Now, I could hypothesize that that may be something to do with the football. Not everybody is clearly a football fan, but it is quite a coincidence that we do have that age group, and particularly males, that were the largest number of cases in that week up to the 27th of June, followed again still by the 10 to 19-year-olds. And we know that is due to the mixing at schools and obviously the very regular testing that thankfully they are all doing to keep themselves and the ones that they love safe. So you can see that we've got a big disparity of different case rates, and we'll look at that in more detail. So if we go down to the first data page, please, Sharon. So you can see here, just it illustrates very nicely that there's been a significant increase. So it's just around a 50% increase on the number of cases from the previous week. And again, the more recent data in the last week is showing a considerable increase again. Now, this is obviously following a national trajectory. And in fact, the East Midlands and Northamptonshire, even within the East Midlands, has been markedly below the escalation that we've seen nationally. Obviously, we're now catching up, and that is because we now have in all of our boroughs and districts Delta variant as our dominant strain. Whereas previously, as I've mentioned before, we have had obviously the Alpha variant was our dominant strain, apart from the East Northants and South Northants areas. As I said, all of our Old Borough and District areas now see Delta as the dominant strain, and that is increasing the infectivity. If we move down. So across the piece, you can obviously see the rates by communicating these as rates per 100,000. It just makes comparison of different areas easier. And you can see the variability in that week alone. So as a county, we had a rate per 100,000 residents, and this is a weekly rate of 42.5. In North Northants, 38.5, in West Northants, 45.9. But as I said, the variation across the county, you've got Kettering down with a rate as low as 18.7 cases per 100,000 population, all the way up to East Northants at 76.2. So really quite a significant spread. And that is to do with the sort of geographic borders as well. There is an influence there. But particularly in the East Northants at this point in time, it was being driven by quite a lot of school outbreaks. If we move down. So this just demonstrates that rapid increase in that dotted grey line at the top, which is the England average rate per week. And then our dashed grey line along the middle obviously has remained quite low and in fact deviated away from that England rapid rise. But you can start to see the telltale signs, particularly East Northants and South Northants, as we've talked about, are creeping back up and starting to follow that trajectory of the England case increase. And as I said, those are the two areas at this point in time that we had confirmed prevalence of the Delta variant. As I've mentioned in the last few days, so in the last week to 10 days, we are now also clear that Delta variant is the dominant variant in our other boroughs and districts. So we do anticipate a continued increase in cases. If we move down. So again, this is a crude count. You can see across the piece, it's an increase compared to the previous week. And obviously you would expect to see a greater number of crude cases in Northampton. It's our most densely populated area, which is why the rates are always better for comparison. But it does just show you how many people are being affected again. And I'm sure this obviously is a reminder of the fact that we do still all need to be being cautious, despite the fact that obviously we are seeing the requirement to take, restrictive steps removed. We do still need to be applying common sense. If we move down. So again, this is just a pictorial illustration of the fact that we, if there's bars above the line, it's because we're seeing an increase in cases. If there's bars below the line, it's because we're seeing a reduction in cases. And you can see that we have obviously had quite a significant increase through June, a little bit of a dip just over a week ago, and then again we're starting to creep up. If we move back onto the next slide, I'll just cover a couple more things off. So here is that illustration I mentioned about the gender split, but also the crude case numbers per 10-year age group. So again, as I said, 20 to 29-year-olds males with the greatest affected age and gender group in the week up to the 27th of June, closely followed again by the school age group, which, as I said, is a constant pattern nationally and certainly locally, and very much to do with that consistent testing. The good news is, and it's the first time I've ever said this, does demonstrate that gentlemen are going and getting tested. And I have mentioned in this meeting before that gentlemen have been more resistant to regular testing. And this is a good demonstration of the fact that the messages about regular testing, helping to get obviously any positives identified, requiring them to self-isolate to break that onward chain of infection, it does show that gentlemen are going and getting tested, which is a really positive thing. So if we just go down to the, thank you, hospitals. The good news is that despite this increase in cases, we're seeing a relatively low increase in hospital admissions and deaths. So in the week up to the 1st of August, or on the 1st of August, we only had 3 inpatients. I do know that that has increased since then, but it is still relative to that increase in our case rate. So it is a small proportion of people who are going on and contracting COVID who do end up being admitted. That is good news, but it does still show that there are vulnerable people within our communities, and we have a responsibility to help protect them by doing the right things. If we just move on to the next slide. So again, this is just a reflection of what I mentioned before. We are thankfully seeing that there is very little morbidity and mortality associated with these increased case rates. That obviously is because we've got a huge swathe of our population are now double vaccinated. But what you must remember is vaccinations don't stop you catching COVID. What they do is reduce the severity and the duration of your symptoms, and they reduce the likelihood of you passing it on. But it is still important that people who are vaccinated continue to test and isolate until that requirement changes. So if we just go down to the outbreaks, please. So one of the things that you obviously will notice is we've had a small increase in the number of outbreaks. We've had very, very few outbreaks. This has increased exponentially in the last week. At the 28th of June, we had 5 outbreaks, but the thing that's telling obviously is that of those 5 outbreaks, we had 82 associated cases. So each outbreak is typically involving more and more cases. So it is just illustrative of the infectivity of this particular variant. You can see that the lion's share of outbreaks there are in education settings. So 3 outbreaks there had a total of 72 positive cases across both pupils and staff. So this still is having a very detrimental effect on our education settings. There is actually at this point that the report was published only 1 education setting that was closed, which really is quite extraordinary. And I think again, just to reinforce our thanks to all of the schools, all of the staff, all of the pupils and families and childcare support bubbles that are testing on a regular basis and trying to obviously maintain some semblance of normality in our education system. But it does just show that once this dominant strain is now in your school, it is very difficult to manage. All schools are still working with our school cell, Public Health England and the local public health team to identify these outbreaks and contain them as quickly as possible. But it does just demonstrate how disruptive it can be if we're not keen to keep on top of those restrictive measures. But I'll stop there and see if there are any questions. Thank you, Cheryl.
Okay, thank you, Lucy. Are there any points or questions from colleagues on the call? Helen,
yes,
did you put your hand up?
Yeah, yes, please. Sorry, I somehow managed to open another screen on my computer at the point I was trying to put my hand up, and so I couldn't function properly. So sorry about that. Yeah. So Lucy, my question is about the testing. Now, obviously, currently we have massive amounts of testing going on. And so we're picking up far more positive cases than we would have been previously in previous spikes of waves of the infection. And I suppose my question to you is, I mean, clearly from a public health point of view, we don't want the virus to spread. But we're getting closer and closer to having, really good coverage with doubly vaccinated people. At what point are we? At what point is this no longer going to be useful? In normal times with, say, flu, if somebody had was asymptomatic but they've got flu, we wouldn't know about it. We wouldn't worry about it. It feels like it's probably useful for people to know that the proportion of people who are testing, the proportion of people testing who are positive compared with before, to just give us a little bit of a sense of proportion, because some people are still, and rightly so, but some people I think are so terrified still, and I do understand it, but are we getting to the point where it's absolute overkill and we're condemning people to staying at home when they perhaps don't need to? And I'm not suggesting that people shouldn't be taking precautions, but it's beginning to feel like if we put the numbers of people dying of cancer on the TV screen every day or anything else like that, we'd be absolutely terrified. And I just wonder if we're getting to the point where this is all becoming a bit overkill now.
I think there's a really difficult balance to strike. So I've talked for a couple of months now about the detrimental effects of prolonged lockdown on mental and physical health and the economy, which obviously is associated with people's long-term health outcomes as well. We know that if you're able to work, if you're able to go socialise, etc., you tend to have better health outcomes. So it is a really fine balance. And we absolutely are having to move to a position, like with flu and many other infectious diseases, where we recognise there's an ever-present risk, but we obviously take steps to try and mitigate that risk wherever possible. The difficulty is, for most infectious diseases, you don't see a lot of asymptomatic carriage. I'm sure Julie would agree, you very rarely see somebody who is asymptomatically carrying flu, and therefore it's easier to manage. Yes, we have the vaccination. As I said, it doesn't stop you actually catching it or transmitting it, but it's about just trying to provide as many sort of levels of protection as possible. So, as you say, continuous testing, it has its benefit, but it's, you know, flaws. It's not always very sensitive. You can get false positives and false negatives. But if you do that as well as get vaccinated and as well as, you know, still maintain good hand hygiene and a sensible distance from people, you know, our environment is as safe as it will ever be. And, you know, as I said, there are detrimental effects to continuing to be locked down that now I think outweigh the risks to most people. And, you know, you can never say that you mitigate it all. There will always be that exceptional person who is vulnerable for a reason that we don't realise, or, you know, we were not able to mitigate against, who suffers a poor consequence of this. But we do have to try and find a way to balance that risk. I think the difficulty is, Helen, that we've had all of the previous waves, like you say, we've had different types of testing availability. You've had only symptomatic testing was freely available in the sort of second wave. In the first wave, it was only people who were hospitalised that were really being tested. So it's very difficult to compare. The thing we do know is that the vaccine works. The thing we do know is that lateral flow tests, for the fact that they're not perfect, do help us identify where people are positive. And we do know that social distancing and face mask wearing works. Now, you might not be required to do that in a couple of weeks' time, but I would suggest that when you're in crowded spaces, etc., it's sensible to do so. But it certainly won't be stopping me going out and starting to try and do all the things that we, you know, all want to be doing again.
Yeah. Thank you, Lucy.
Thank you, Helen. Thank you, Lucy. Will next, and then Danny. Hi, Will.
Yeah, hi Matt. Thank you very much. And sorry, I had my microphone earlier on with the background noise. My fault. I'd forgotten I'd switched it on. I actually, just reflecting on that last discussion between Helen and Lucy, you're both right, aren't you? This is really difficult, and it's a balance, a judgment issue, isn't it? And I guess, you know, society needs to but they're on a flat roof next to me, and I need a bird scarer or something. But the society must be we are on a gentle trajectory, aren't we? Where those issues that you described about freedom and responsibility are moving slowly as a group. And I suppose what we all need to do is to reflect, you know, kindly on each other and different points of view and different opinions, so that we cope with people's fears, but also those who well, fears of too much lockdown and fears of too little lockdown. We need to cope with both somehow, and it is difficult. So totally sympathise with your points of view there. My question, Lucy, was you might not know the answer to this, but you know those education outbreaks in your final slide. Do you happen to know the age groups that pertained to those? Was it all in one age group, or was it scattered, or what?
So we do know the age groups. In each school, it's actually been different year groups that have been affected. It is primarily secondary, because obviously they're the ones that are doing the more regular testing. But we are seeing primary school age children affected, but it is typically identified because they're siblings of a child that's regularly testing and is in a secondary school. So you do tend to see that epidemiological link between different year groups because of siblings. And again, it just demonstrates that the transmission is actually happening at home. It's not happening within the education setting itself. So schools don't pose a risk in and of themselves to our pupils. It is primarily the behaviours outside of school that are driving those infection rates. But you know, we know that children don't they struggle to maintain social distancing, that they are much more physically, in contact with each other. They cough and sneeze and all sorts all over each other. And, that's why we will never sort of eliminate this virus, but we certainly just want to make sure that with that regular testing, we're helping identify where it might be and stopping it spreading to others who may be vulnerable. Although, as I said, we haven't seen very many hospitalisations at all, and certainly not in younger children.
Okay, thank you very much.
Thank you, Will. And Danny?
Thanks, Matt. So congratulations on the wonderful vaccination programme in the county and the ongoing effort there. It's been absolutely brilliant. And it's very clear then that the vaccination programme has broken the link, is the phrase, isn't it, between infection rates and hospital admissions and deaths. But what's your view, Lucy, on that? Is it a clear break now? How can we be sure that it's actually not a break, it's just a longer lag?
The honest answer is we can't be sure. So what we do know, obviously, as you say, is there is irrefutable evidence that the vaccination, particularly 2 doses, that must be reinforced, that information that 2 doses are required to get a reasonable level of protection, particularly with the Delta variant. But 2 doses do reduce, as I said, severity and duration of your symptoms if you happen to catch it, and also reduce the likelihood of you transmitting it by up to 60%. So, each person that gets doubly vaccinated is not only helping themselves, but potentially helping people around them who either haven't been able to get the vaccination, aren't eligible because of their age or an underlying condition, or indeed perhaps, as we've talked about, have chosen not to, because there is an element of choice still clearly with this. What we must recognise, though, is that the lion's share of vaccinations were rolled out during a significant lockdown period, and that also will have helped just reduce the case rates. And you can see again, they're starting to increase as we come out of those restrictions. And the other bit that we just need to recognise is we're still finding out more, not only about the variants, but also about the length of efficacy of the vaccine itself. So there are obviously plans which are being developed for a booster schedule starting in September alongside flu. And that looks like it will follow a similar pattern of rollout with regards to age and clinical vulnerability first, and then moving down into younger age groups. But it is unlikely to cover all the way down to 18s in the way that this first schedule has. So we await further information from that, but we know that obviously any artificially sort of created immunity through vaccine delivery reduces over time, and that's why that booster schedule is obviously in development at this point in time.
Thank you. Helen, did you want to come back in?
Yeah, thanks, Matt. Just following Danny's questions about vaccinations, sort of triggered a thought in my mind. I heard the other day what I thought was a fairly alarming statistic that in of the people working in our local general hospital, Kettering General Hospital, roughly 20% of those people haven't taken up the vaccination. And I've obviously that concerns me, particularly as we've been told to protect the NHS. And so I wanted to find out what the figures are for care workers. Now, care workers have now been told that there's a period of time in which they've got to get the vaccination and they're mandated to have it. Hospital workers are not. I think that's actually truly worrying when you consider how absolutely vital the vaccination is in defeating this virus. Well, not defeating it, but managing this virus. And I just wondered, Lucy, if you had any. I mean, I know an awful lot of work is going on to try to persuade those people to take up the vaccine, but it does seem a rather alarming thing to me, given the expectations on members of the public and to find that out.
Yeah, so while you've been talking, I've been scrabbling through my email inbox to try and give you some specifics. So if I just tell you sort of where we're up to, she's just trying to find the information again. So from a point of view of healthcare workers for NHS trusts, we're actually up to 89.81%. So that will obviously that excludes residential care workers, care home residents, and healthcare workers and primary care, social care workers. This is purely NHS workers. Locally, it's actually 89.82%. 0.81%. Admittedly, well, no, actually in a day that had gone up 0.02%, because this is a daily report that I get. It does obviously mean that 10%, just over, of our NHS trust staff have not been vaccinated. Now that might be back office staff. Please do remember that. It won't necessarily be frontline staff. This is all NHS trust staff. But that to me is, you know, a pretty good statistic locally, clearly room for improvement. As you mentioned, social care staff, it's now mandated that they are vaccinated in the next 16 weeks. And there is a consultation that I understand is going out, if it hasn't gone out already. I don't know, Julie, if you know, around mandated vaccination for healthcare staff. I don't know if you, yeah, so I understand that's going out imminently if it hasn't already. Obviously, we would want all, you know, members of the public and staff, no matter where they work, to be coming forward voluntarily. And if they have concerns about the vaccination, safety, efficacy, anything, and they can obviously dial 119, speak to the local public health teams, or indeed book their appointment, whether it be at their GP practice, the vaccination centre, or a pharmacy, and ask those questions when they do attend to get some assurance. But I would suggest don't assume you know or worry about those questions. Go and speak to somebody who does know. There is a reason that these case rates have gone down, and that is because the vaccine works.
Okay, thank you. And I just had a couple of points, and I think you've answered this anyway, but the admissions and hospital admissions and deaths, there's a clear link to obviously people not being vaccinated and those admissions, isn't there? Yeah. And then I just wanted to echo that point you made, Lucy, around schools, to thank schools for the amazing work they've done. You know, I've got a young family, I've got brothers and sisters. You know, we all know kids at school. The schools have gone way above and beyond in trying to get kids back to normal, and we you know, I just want to really reinforce that thanks you made, Lucy. And whether it's a crystal ball question, I suppose, do we know how normal next term may look? I was just going to throw that over to you and see whether you could give us a view of the future in that regard.
Absolutely no idea, if I'm honest. I think there's a couple of variables here that we're still really not sure what the national policy will be around. Obviously, the vaccination for younger people, so for under 18s, you know, has actually been approved from a JVCI, you know, safety perspective, but a definitive decision around whether it should be rolled out hasn't been put into policy yet. And obviously there will be ongoing conversations about that over the summer holidays, I am sure. The other thing obviously is about testing, whether testing will remain a part of school life come September, either prior to return or even, you know, as an ongoing requirement. One of the things that obviously it has been tested more recently is something called test to release. So some schools nationally, where obviously they're taught in bubbles, and if one pupil tests positive, the whole bubble has to isolate, and sometimes that can be, you know, 30 or 40 students at once. What they have done, and they're piloted in some areas, is that all of those pupils test on a daily basis, and if they're negative that day, they're able to go to school. And if they test negative consecutively for 5 days, they can just return to school without having to continue to do the daily testing and revert back to the twice weekly testing. So there's lots of different pilots, etc., that are going on. So I don't think we'll see a complete removal of any sort of, you know, mitigating factors, but I certainly would hope that it would be more facilitative, that pupils can remain in school even when there are positives in that establishment. Yeah,
thank you. I agree. Great. Okay, we'll move on the agenda then, if that's okay. And I think you're taking Toby's slot, Lucy, on the vaccination update. Is that okay, Lucy?
Sorry, I couldn't get myself off mute. It is indeed. Yeah. So let me just get back to the right. I've got open the whole of the vaccination report. So really the headlines from a point of view of the latest internal data. So this is up to the 6th of July, and it will obviously, it takes a little while to kind of end up in the national stats, but we've administered locally 825,203 vaccines up to the 6th of July. That's 476,088 first doses and 349,115 second doses. So what we're seeing from a point of view of different age groups, obviously we know we've got really high uptake in the sort of 70 pluses, but at least one dose, even in the 18 to 29s, where it's only been open, I think it's about 3 or 4 weeks now, 62.9% of the eligible 18 to 29-year-olds have had their first dose. 75.1% of the 30 to 39s and 85.3% of the 40 to 49. So you can really see that the longer that age category has been eligible, people are still continuing to get that dose. Obviously of the second doses, which is a slightly different age group because they were opened earlier. So 50 to 54s, we've got 86.1%. Really good news, 55s to 59s, we've got 93% have had both doses. 60 to 64-year-olds, 94.8% have had both doses. And 65 to 69-year-olds, slightly lower at 89.8% have had both doses. But again, you can just see that there are clearly a lot of people who are still wanting that vaccine, going out, getting it. And the important thing is that our provision locally is obviously managing to keep up. And I know that there are still lots of drop-in sessions available, particularly at the vaccination centre. You don't need your appointment. You just need to turn up with your NHS number and they will give you either your first dose or indeed if you've had 8 weeks since your first dose, they will obviously facilitate your second. There are drop-in sessions and there's going to be a pop-up clinic in the Market Square in Northampton this Saturday from 9 AM to 5 PM for anybody over aged 18. And again, drop-in sessions, the time has now been extended at Moulton Park Vaccination Centre from 8 AM to 7:30 PM every day. And obviously you've got lots of drop-in sessions happening at different GP practices and pharmacy sites as well. So please do go on to the local vaccination website to take a look at that. Having said that, there are obviously areas where we do have lower uptake, and geographically central Northampton is really challenging. So what we're doing at the moment is just developing a leaflet so that we can drop it in to give people information, try and do some myth busting, give them some direction to where they might want to find out more, and obviously information about how they can just get into one of those drop-in sessions somewhere local. There are now 10 community pharmacy sites and an 11th is going to be opening very soon in Corby. And again, it just gives people more choice and you know, less need to travel for those that don't have the ability to do so or don't want to get on public transport at this point in time. It's just trying to make sure that we're taking wherever possible these vaccinations out to people. But obviously we just want to make sure that everybody who's aged 18 or everyone who hasn't had their first dose to obviously come forward and get their jab. As I said, it can be booked if they preferred. Some people like to know exactly when they're going to go and where, but obviously other people like to just turn up, and we've got all of those different offers available to help support that.
Thank you, Lucy. And I'll just ask a question, and I can hear Councillor Stone asking the same question, you know, a while back, and she's not on the call today. But those hard to reach areas in Northampton, we've talked about a number of times, and you talked about some plans to put a leaflet out. I just wondered what has happened. You know, we've had these sort of conversations for quite a long time now. What has happened, and have we engaged, you know, different parts of the community and how we've done that? Thank you.
Yeah, absolutely. And Kath may want to come in on this as well. But there's a consultant in public health who works dedicated 2 days a week, just purely looking at inequalities in vaccine uptake. So that might be to do with ethnicity, it might be to do with geography, it might be to do with language barriers, you know, whatever the reason that people aren't engaging. We're working with the engagement team within the councils just to meet with those community groups, those, you know, particular groups, you know, that either have a religious group behind them or a, you know, particular area or geography that they tend to live in or indeed work in, because some of this is, you can even look at particular employment types. And it's just trying to understand what those barriers are. As I said, this is one of the reasons that we're starting to develop particular leaflets, and this is down to street area. We've got the information in Northampton. Again, we're looking also at Corby, because there's areas in Corby with low uptake. We're making sure that there's appropriately translated resources. And as I said, all of that's being informed by focus groups, etc. We had a deep dive, actually, wasn't it 2 weeks ago, Kath, with a number of community leaders who joined the public health team, some of our vaccination leads and our engagement leads, to give their insights into, why they were hearing that people weren't turning up for vaccination, and they were obviously putting forward lots of suggestions about how we might be able to overcome either barriers to access that are physical about, travel, etc., that we've talked about, or just, as I said, doing some myth busting. A lot of this is about misunderstanding or people being sort of misled by information that they may have got that's not from a reliable source.
Thank you. Good. Are there any other points or questions regarding the vaccination? And, I think we're all happy to not conclude, but note, it's the Northamptonshire, the response has been fantastic, hasn't it? And, I know Chris has been on this call and various other calls who's led the vaccination programme. It's been an excellent effort. Will?
Yes, thank you, Matt. I totally agree with you. Applaud the effort. Fantastic. Well done, Lucy and team and everybody, and Toby and team and everybody. Just a quick thought, though, on the, the opportunities for walk-ins at the moment. We've got a newsletter going out tomorrow, Lucy, and I wondered if there is, if you want to ask one of your team to pop me a quick note, we can publicise what people can do. And I think we have a circulation of about 3,000. So probably, to be honest, we're going to 3,000 vaccinated people, but there might be family members. So if there is anything, if you send it over, we'll include it in our newsletter.
Thank you very much. Kath, are you happy to pick that up with Will? Lovely. Thank you. Kath's my comms lead, Will, so she'll drop you a line.
Brilliant. Thanks, Kath.
Excellent. And Phil? Good morning, Phil.
Good morning, Matt. Sorry I got here late. Thank you. Question for Lucy about the future, I kind of guess, and we're doing everything, but what about revaccination, or whatever you want to brand it, flu vaccinations? I mean, obviously Toby's working like mad in the background, so they're planning this, I guess, but have you got some sort of insight into where this might affect us locally?
Yeah, so I mentioned earlier, but Julie as well.
Oh, I missed that earlier.
No, not at all, Councillor Bignell. But Julie, feel free to come in as well. Basically, we're just awaiting a little bit more guidance, but there will be a booster schedule. We are awaiting a little bit more guidance about whether you can literally have a jab in each arm, so have your flu at exactly the same time as your COVID booster. Obviously, it's going to be to do with supplies, and we're just waiting again for confirmation of which groups go first, but it is likely again to be related to age and clinical vulnerability. But it looks like it's going to be around a September start. Julie, is there anything you want to add to that?
No, I mean, there's nothing I want to add. I mean, that's where I understand we are at the moment as well.
Yeah, because my main concern was, I mean, this time last year, you say you can't jab flu and COVID at the same time, or whatever time last year it was, and it has to be 4 weeks apart, blah, 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 blah. There seemed to have been a U-turn. I was curious about that, Lucy.
Genuinely, it's because obviously the COVID vaccination and the various COVID vaccinations that are now available were so new that obviously you need to run trials to look at whether they obviously interact with each other and whether there are any what are called contraindications to giving both vaccinations at the same time. They've run those pilots and trials, and it looks like it's absolutely safe. One of the things that obviously is worth noting is we do give multiple vaccinations at the same time quite often, but obviously you always have to test that because this was a new type of vaccine. But we do it with childhood vaccines. We do it when we quite often give flu and pneumonia, which are separate vaccines, but we give them literally one in each arm. And quite often we have multiple jabs if we travel abroad. Yeah. So this isn't something that we don't do. We do it very regularly, but we always have to make sure that there are no sort of reactions between the various vaccinations being given, and that's the trial that's happened over the last year and provides us with that reassurance.
On the last point, you call it a booster jab. Toby was he kept calling it revaccination, and he got quite upset about that. I mean, generally the government talk about booster. What is it? Is it a revaccination or is it a booster?
I have to be honest, I can't remember the reason why there was a kind of a push more to call it a revaccination, but you're right, that's an old habit of mine. Julie would have probably said booster as well.
Yes, I would have done. Yeah,
absolutely. Yeah. So I think one of the things you've got to remember is you may get one of the different vaccines. And also you've got to remember it also may have different strains in it. So it might be almost a kind of a new variant of the vaccine that's in it, rather than it being a booster of the same that you had previously. And just to mention as well, not only have they been trialling whether you can have flu and COVID at the same time, they've also been trialling 2 different COVID vaccinations and the combination of different strains of COVID in one vaccination. So All of this has been being trialled to make sure it's safe over the summer. And again, just to point out where people are a bit concerned about different strains of one virus being in one vaccine, we do it every year with flu. There are 2 different types of flu vaccine. One is called trivariate vaccine, which is trivalent vaccine, which has got 3 different types of flu in it. And we also have a quadrivalent vaccine, which has got 4 different types of flu in it. So again, this is not new science. It just happens to be a new virus that we're trying to fight by doing it.
Thank you. Great answers as ever. Thank you.
Thank you, Phil. So we'll move on to the testing and contact tracing update, and over to you again, Lucy.
I'm sorry, it's me again. I'm hoping most people have had a look at this, so I won't bore you with the sound of my voice for too long. But really, again, just pushing the message here. This is a really good news story. We were one of the areas that took up local contact tracing to enhance the national programme very early, off the back of the rather large outbreak we had last summer. And it has absolutely benefited us locally, not only by keeping our case rates lower than a lot of other areas, but also just providing our residents with additional support. Because not only do we go and get contact information from them, but we also make sure that all of those people have got access to food, to medication, to social support if they're lonely, advice about nutrition, etc. And the support pack that we send out has actually been adopted by a number of different councils as best practice. So just reinforcing that the benefit of this, it isn't just us checking up on people, it is genuinely about giving our residents support. But if we just have a quick look at the stats, Cheryl. So this is our performance over time. Again, what happens is the national team gets the information about the test, the case and their contacts for the first 24 hours. They send out a virtual questionnaire for people to complete about who they've seen. And then anybody who hasn't completed that information then gets passed on to us and we do the rest. So 91% of people are followed up locally, all of the contacts and cases, which if we go on to the next slide, compared to other areas, demonstrate, we're up there regionally. Only Rutland has had a slightly better performance than us at one point in the past. And bearing in mind the diversity and the size of our county compared to Rutland, it does just demonstrate what a good service this is. If we move forward, one of the things to note, if we move on, Harold, that sometimes obviously the number of cases that we have to contact is relative to the number of the rate that's circulating at the time. You can see that the one at the end is the current week, and at the moment we've only contacted 70 people, but that's halfway through the data. But you can see in the previous 2 weeks, just the big jump that we've had, it's a 207% increase in the week prior from a point of view of the number of contacts that we were having to follow up. And that is just, a symptom of how many cases we've got locally. So please don't underestimate how much work this does take with the team, and they're very committed to making sure they speak to every person that they can get the contact details of to make sure that they're safe. They know what to do. They've got everything that they need for their isolation period. So if we just move on. So that gives you a breakdown of how we managed to get hold of them, on those that we don't. There are still a small number that we just fail to make contact with because we don't have the right contact details. We do door knocking, we do letter delivery if we don't have telephone details. So, it isn't a light touch programme. We do really actively try and reach out to these people, but we do still have a small proportion of people who just refuse to give information. That has actually reduced down to 6%. As you can see, that used to be around 9%. So that does mean that more people are engaging with the programme, but I would just encourage people to do so. This isn't Big Brother. We don't use this information for any other purpose than to make sure that people know what they're required to do to keep themselves and the people around them safe and have everything that they need for their 10-day isolation. If we nip on to, I will just make sure that people know what else is in the pack. That gives you a definition of each of those outcomes. But if we just move on to the testing. So PCR testing is still the required test approach for people who have symptoms. And again, if you get a ping because you have been in contact with somebody who is a confirmed case, you may well, even if you don't have symptoms, be asked to go and have a PCR test. These can obviously be delivered through postal services and drop back off into post boxes as well. But of the static sites and the mobile testing units that we have, this is where they are in the county at this point in time. So there's lots of availability, again, all the way across the county. There's a little bit more information, and obviously information about how you always get that most up-to-date information, because at the bottom, the mobile testing units, the MTUs, they are by their nature mobile, and so they only stay in one spot for a week or so, and then obviously we put them where case rates are highest or where there may be an outbreak in the area. So please do keep a note of that link at the bottom, because that will tell you where they are at any one time. But if we just go down to the lateral flow testing information as well, there's a bit more information there about uptake and test rates. But for people without symptoms, obviously that first slide, if we just go back one, sorry, Gerald, we obviously have got different ways of doing it. You can get tested at work or school. You can go to one of the asymptomatic testing sites that we'll talk about in a second. You can collect a home test kit from one of the LFT sites that we just mentioned, one of the ATS sites, so the asymptomatic testing sites, or indeed a number of participating pharmacies, and there's over 100 in the county that will be able to provide you with those tests, or indeed you can just order them so they get posted home, and that is what I indeed tend to do. So if we just go on to the next slide, it shows you where those asymptomatic testing sites are. People will notice that that is a reduction on the ones that we've had before, and that's because the government, in line with all of the sort of changes to this being the new normal, have said, let's have fewer of those static ones and let's actually make sure we've got some more mobile options. Again, so we're developing and ordering vans to hire, which are kitted out as little testing units, and we will be taking those out to areas where we've either got high rates, low rates of testing, or indeed where we've got particularly vulnerable groups or groups that are hard to reach who, you know, through some of the engagement work we've done with the comms team and with the engagement team and the community leaders, it's clear that those people aren't tested on a regular basis. So there's going to be these static sites, but then a number of mobile options which are very targeted to support people who maybe haven't been engaging, or indeed that where there are some particular issues around case rates or low testing rates. So you'll see, as I said, a little bit of a change. If we just go over the next couple of slides. That just shows you the uptake. So plenty of capacity in all of these sites. And again, one of the reasons that the government has started to say, let's make sure that we're taking testing to people rather than always expecting them to come to us, because the capacity isn't being used. So you can see those ones that we've closed as well. And if we just move on. There's our stats from a point of view of testing uptake, and you can see over the last few months now it's been relatively steady, which is good. We always want to see more testing, and as I said, as we take these further restrictions, these last few restrictions away, I would obviously be encouraging people to do this on a regular basis so that they know that they're safe and are keeping the people around them safe. Last couple of slides just give you a little bit more detail about those pharmacy collection sites, as I said, over 100 across the county. And last couple of pages, Cheryl. Just a summary at the end of, as I said, you'll see that testing model that's more mobile be rolled out, so it's targeting areas and communities. And at the moment, we've got all of those mobile testing units agreed until the end of July, and obviously we're awaiting just a little bit more guidance from government as to how and when the public will be testing on a regular basis going forward. So please do note there's lots of information there. Feel free to share that if it's useful with any of your sort of partners and colleagues, but otherwise I'm happy to take questions. Councillor Golby.
Thank you, Lucy. Any questions for Lucy, colleagues? Will.
Yeah, it's just the same point, Matt, if I may. Lucy, could Kath include a couple of those slides in when she sends me that pack, and we'll put them in the newsletter tomorrow? Brilliant, thank you.
Okay, brilliant. I think there's some very comprehensive information there, and it'll be. I'll make sure I resend that round to all members as well in the West, and I'm sure it's like Helen. She's happy to do that in the North. Okay, colleagues, that brings us to the end of the agenda. So we've got a future meeting date of the 19th of August, which isn't that far away.
Sorry,
Sorry.
Matt, are we going to further cover communications?
There's a communication update.
Oh, sorry. Okay. I'll stop and start again. Communications.
Thank you. Yeah, I was just looking back at last time I gave an update, and I think we were about in the step 2 situation at that time. So quite a lot has happened since then. You'll probably remember back we had a campaign called Every Touch Could Leave a Trace. So that was when we were still quite heavily in lockdown. And as we moved through into step 3, we did a campaign called Take Care in the Open Air, which I hope some of you will be familiar with. It was quite widespread. It was across bus shelters, buses, outdoor signage in general, across the social media, and many of the old district and borough areas put banners up across playgrounds, children's play areas, lots of different public spaces. I've been sent lots of pictures of them all over the place, which is really great. And they were really just in line with opening up slightly, helping people to make decisions for themselves, which is what we're seeing more and more of, helping people to make decisions considering risks appropriate to them. And as we moved through June, when restrictions eased even more, we started to look at the things, so people are mixing more, and again using the evidence to kind of identify what sort of challenges people are facing. So meeting up with other people and the risks that kind of brings. So we were trying to give people advice about cuddling considerations. So if they were maybe vulnerable or hadn't had their vaccine or met with lots of people, they might be at higher risk than people who don't meet with many other people who've had both vaccines and are otherwise fit and well. So we've been trying to give people the right information for them to make decisions for themselves about their risk and how they kind of behave as a result. Part of that has also been to really push the testing messages. So Lucy's talked quite a lot about this, and I think as we move forward, it will continue to be quite important. That when taken correctly, the lateral flow device test taken twice a week detect high levels of infection. So if you're taking them twice a week, you're likely to pick up if you've got a high level of infection, and it's a really useful tool in protecting others. So if you pick that infection up and you isolate, then obviously you're not then going to mix with other people and spread the virus on. So that's quite a key message that we're trying to promote. We've delivered posters all around the different town centre areas to pubs, restaurants, hair and beauty salons, hairdressers, you name it, lots of different venues to try and encourage people to take up twice weekly testing. The home test kit delivery service is really good. The kits arrive the next day, so you just go online and order them, or you can collect them up at pharmacy sites. And as Lucy mentioned, there's a new testing kind of process coming on board, which we'll be supporting as well. So we've still got those take care in the open air messages out there, but I think as we move towards the July 19th deadline, we'll be trying to focus again on helping people to make the right choices for themselves. You know, we've already heard a difference of opinions, and it's really about people weighing up their risks and making the decisions that are right for them. So that will be our focus with regard to the lifting of restrictions, and obviously still focusing on testing. I just wanted to mention that you'll probably know we've been working with an influencer called Tessa Bear. She is, I think she's about 18, 19 years old. She's got loads and loads of followers on TikTok. She's been really great working with us, and she let us film her going to get her vaccination, which was really good because obviously getting that message to young people is really important. And our work with her and our work on the self-isolation packs has been recognised nationally. So it's really nice to kind of have that recognition from the national teams to sort of say that's good practice and share that with other areas. So we're really pleased about that. A couple of other bits to mention. It's been mentioned already, but we're doing a lot to work with Silverstone, both with the circuit staff and the teams, and also environmental health officers. Stuart Wild and Ruth Austin and their teams. We've done some posters for the campsites because, as mentioned, Step 3 regulations apply on that particular weekend on the campsites and outside of the kind of red area or whatever you call it. So it's important that people comply with those rules on the campsites and outside of that circuit. We're also looking at using some geolocate targeting, which can be used down to kind of very narrow, I don't know what you call them, like longitudinal, latitudinal positioning to target people in very specific areas through mobile phone targeting. So we're looking at that as well. Thank you day. I just wanted to say thank you to everyone who was involved in doing the messages for Thank You Day. They were very well received. We got some really good social media uptake. So thank you to colleagues who supported that and to everybody else involved in that. It went down very well. We're also doing a leaflet to give out at the vaccination centre, which kind of promotes the other public health services. So again, that's been mentioned, the mental health aspect, physical well-being, people who might want to stop smoking, lose a bit of weight, all of the other services that are on offer. So when you're having that second or first vaccination, you're waiting in the waiting area, there's a leaflet that you'll be able to just look through just to see if you need any other support, that will be there. And then just to touch slightly on the work with other communities. So I think that's been mentioned a few times. Really the key with that kind of work with BAME communities and those communities who don't speak English as a first language, it's been really key working with local councillors, community leaders, engagement and community colleagues in the boroughs and districts. And it's a very different approach each time as well. So for example, the Polish community might still seek to get their information from their home country. So the Polish guidance in Poland might be very different to what the UK government are saying to UK residents. So it can be very it can be on that level that sometimes the comms are very different between countries. We need to address that. Or for instance, still using Poland as an example, their vaccine rollout isn't carried out in the same way. So whereas we all get a letter, they only get a letter if they're a key worker. So the approaches are different. So we have to work really hard to understand what's going on and being communicated to those groups and how to overcome that. So it's quite complex with each different group, but just to give you a little picture of one of those groups and what's going on. I think that's pretty much everything.
Thank you, Kath. That's an excellent report, and it's great to hear of, how you've innovated and take advantage of different channels, TikTok, influencer, and the whole sort of comms challenge has been central to how we've pulled together as a system to fight COVID. And I think it's great that we've got some national recognition, because I've seen, going way back now, that we've done a really good job. And going back to when the number 10 task force came, I remember they spoke about how well we were communicating and the different channels and things, and they again took away some best practice. So done a really, really good job. So that's great to hear. Notwithstanding, there are still some challenges, but again, it's good to hear that you're using different styles to work with the different community groups and things. So that's really, really good to hear. Are there any comments or questions from colleagues? No, I think you got away with that one. It's a very comprehensive report. Okay, so I think that does bring us to the end of the agenda, if that's okay. And we've got the next meeting down as the 19th of August, which feels like it's a long way away, but it's not really, is it? Because the year's ebbing away very quickly, and a lot's going to happen in the COVID world between now and then, and hopefully we'll be a lot more open. Of course, the challenge is still there, but things are moving quite quickly at the moment. So I'll thank everybody for their attendance. I hope some people were viewing it via the recording on YouTube. So I hope that was really useful for everybody. Wish everybody well, and we'll see you at the